Good afternoon, everyone. Today we'll be presenting on the role of a fitness and wellness coordinator. My name is Anthony White, alongside Chase Kreitzer and Dr. Malcolm Gold, and this presentation is for Microeconomics 202, Spring 2026. In this presentation, we'll walk through what fitness and wellness coordinators do, how supply and demand applies to this career, and what trends are shaping the field today. Fitness and wellness coordinators are professionals who design and implement exercise and wellness programs. They work in a variety of settings, including gyms, universities, corporate wellness programs, and healthcare systems. This makes the role very versatile across industries. They regularly interact with clients, healthcare providers, and management, meaning strong communication skills are essential. In terms of organizational structure, they often report to wellness directors, human resources departments, or facility managers. From an economics perspective, this occupation exists in a competitive labor market where workers differentiate themselves through education, certifications, and experience. So, what exactly do fitness and wellness coordinators do on a day-to-day basis? First, they create individualized fitness programs tailored to client needs and goals. They also lead group exercise sessions, which could range from strength training to wellness classes. Another key responsibility is tracking client progress and measuring outcomes, which helps demonstrate the effectiveness of their programs. At a broader level, they may manage wellness initiatives across an entire organization. Finally, they play an important role in promoting healthy lifestyles and encouraging long-term behavior change. Now let's look at labor demand. Demand for fitness and wellness coordinators is derived from firms' need to provide wellness services. In other words, companies hire these workers because they add value. Employers consider how these professionals can reduce healthcare costs, improve employee productivity and retention, and enhance the company's image through wellness programs. So, the stronger the impact on these areas, the higher the demand for workers in this field. Continuing with demand, we take a look at marginal revenue product, or MRP. Firms will hire workers up to the point where the marginal revenue product equals the wage. If a wellness coordinator generates more value than they cost, for example, by lowering insurance expenses or increasing productivity, then hiring more of them makes sense. However, if the financial benefits are low, demand for these workers decreases. So ultimately, demand depends on how much measurable value they bring to the organization. Several key factors are currently increasing demand in this field. First, rising health awareness, especially after COVID, has made people more focused on wellness. Second, the aging population increases the need for preventative health services. Third, the prevalence of chronic diseases creates a stronger need for fitness and wellness programs. Additionally, corporate wellness programs are expanding as companies invest more in employee health. Finally, demand tends to be higher in urban and higher income areas where organizations have more resources to invest in wellness. Looking at the global perspective, the United States is currently the largest wellness market. However, faster growth is happening internationally, particularly in regions like Asia, Pacific, and the Middle East. This growth is driven by a rising middle class and increasing health awareness worldwide. So while the US dominates today, global opportunities in this field are expanding rapidly. Now let's shift to labor supply. The supply of workers in this field is relatively elastic, especially in the long run, meaning more people can enter the profession when wages rise. Typical entry pathways include a bachelor's degree in kinesiology or exercise science, along with certifications like NASM or the American College of Sports Medicine. There is generally a larger labor pool at the entry level, but fewer qualified candidates for higher level roles that require experience. In terms of barriers to entry, They are considered moderate. Education, certifications, and experience are required, but entry is still easier compared to clinical healthcare roles. As wages increase, more workers are encouraged to enter the field over time. Finally, let's look at overall market trends. Employment in this field is projected to grow by about 12% between 2024 and 2034, which is faster than average. This growth is driven by a stronger focus on preventative health, the continued expansion of corporate wellness programs, and increased demand for personalized fitness services. Overall, the outlook for fitness and wellness coordinators is positive, with strong opportunities for growth in the coming years.
Next, let's look at wages and elasticity in this field. Elastic labor supply can actually limit wage growth. When there are a lot of available workers, employees don't feel as much pressure to raise wages. However, specialized roles tend to earn more because those skills are harder to find. Having niche abilities increases your bargaining powers as an employee. Technology also plays a big role. It can automate some jobs, reducing demand, but at the same time, it increases demand for highly skilled positions that can work with or manage that technology. So how do you actually become a fitness and wellness coordinator? Most positions require a bachelor's degree in kinesiology, exercise science, or a related field. You'll take courses like anatomy, physiology, and nutrition to build your foundation. Internships or clinical experience are really important because they give you hands-on skills and exposure to the industry. Certifications such as ACSM or NSCA boost your credibility, and CPR or BLS certifications is also often required. Work experience like training clients or assisting professionals also improves your chance of getting hired. Finally, standing out through specializations, networking, and continuing education can really increase your job opportunities. There are also several related careers in this field. In exercise physiology develops fitness and rehabilitation programs to improve patient health. A health educator focuses on teaching people about healthy lifestyles and disease prevention. A recreational therapist uses activities and exercise to improve both physical and mental well-being. And a program manager oversees wellness programs, coordinating staff and resources. These options show how broad the health and wellness field really are. To succeed in this career, certain personality traits are essential. Strong communication skills help you clearly explain workouts, give feedback, and build relationships. Leadership is important for guiding programs, supervising teams, and motivating others. Emotional intelligence allows you to understand clients' needs and creates a supportive environment. And adaptability helps you adjust programs and work with different personalities in changing situations. This career also has a career path for growth. Most people start in entry-level roles like fitness trainer or wellness assistant, where they gain experience. From there, they can move into a coordinator position, taking on responsibilities like planning programs and managing schedules. With more experience, they may become directors, overseeing entire departments and managing budgets. At the highest level, some transitions into corporate roles, designing large-scale wellness programs or consulting for organizations. Each step comes with more leadership responsibility and greater impact. Insight from professionals in the field highlight a few key points. Corporate wellness programs are becoming increasingly important and should be offered in more workplaces. Having the right certifications and a specialized degree can make a big difference. It's also important to stay humble and know when to ask for help. Interestingly, personal training often pays more than institutional jobs like working at a college. One quote that stands out is, "Athletes don't care how much you know until they know how much you care." Finally, continuing education is required every 3 years and can be completed in a variety of ways. In conclusion, the demand for fitness and wellness coordinators is growing as more individuals and organizations focus on health, wellness, and prevention care. This career offers strong opportunities for growth, specializations, and making a positive impact on people's lives. Here are the references we use for this presentation, including sources from public health organizations, industry reports, and academic research.